Good afternoon and a warm welcome to our audience. I am Jasmine from 2050 Healthcare. Today we are here to delve into a crucial topic that affects millions of lives worldwide: traumatic brain injury, commonly referred to as TBI. Traumatic brain injury is a significant health concern causing a range of physical, cognitive, and emotional challenges for affected individuals and their families. In India alone, TBI is a prevalent condition with a substantial impact on public health. Throughout this session, we will explore various aspects of traumatic brain injury, including its causes, diagnosis, treatment options, rehabilitation strategies, and long term outcomes. Our goal is to enhance understanding and awareness of TBI, empowering healthcare professionals, caregivers, and the community to better support individuals affected by this condition. Joining us today are esteemed Dr. Jaydev S., a distinguished specialist in neurosurgery, renowned for his expertise in traumatic brain injury. Dr. Jaydev S. practices in Bangalore, bringing a wealth of knowledge and skill to his patients' care. With qualifications including an MBBS, MS in general surgery, and MCH in neurosurgery. Dr. Jaydev S. is equipped to address a wide range of neurosurgical conditions. His areas of specialization encompasses epilepsy, multiple sclerosis, and peripheral neuropathy, among others. Notably, Dr. Jaydev S. excels in managing complex issues such as scoliosis, seizures, and trigeminal neuralgia. Each case is approached with meticulous expertise and personalized care, ensuring tailored treatment plans that cater to individual needs. Whether managing lumbar disc issues, skull fractures, or brain tumors, Dr. Jaydevis is dedicated to delivering optimal care and enhancing patients' outcome. Welcome, sir. So, my first question for you is: what is traumatic brain injury, and what are the primary causes of traumatic brain injury?
As the word says, it is traumatic. This trauma is the trauma. What we mean by trauma is injury. Most commonly, it is road traffic accidents. Is the most leading cause. And apart from that, it might be in construction workers where there will be a fall from height. Other causes include some fall of heavy object on the head, and sometimes it can be assault. These are the most common causes. In children, possible a fall from a bed, fall from stairs. These are the lesser common causes.
Thank you, sir, for your answer. How do you diagnose traumatic brain injury in patients?
Diagnosis starts by, first of all, by the history. The patient himself or the relative himself brings the patient and they'll tell us the patient had a fall or there was an accident and there was injury to head. So the trauma to the head itself, by history, we come to know the diagnosis. It's simple. Apart from that, if in an unconscious patient, suppose history, we don't get the history, suppose the patient is unconscious or he was brought by somebody else. In such cases, there will be external head injuries. If a patient is comatose, that means their brain would have been severely impacted. So there will be external marks of injury. There might be some bleeding over the face and head region or associated injuries. In such patients, external injuries will lead to a diagnosis. This is by just history and examination. For more, what what is the severity of the injury, what part of the brain has been injured, there are other aids. Radiologically, by ordering, most commonly, we do a CT scan of the brain, which will give us information regarding which part of the brain has damage, and if there is a bleeding, how much is the bleeding. This we'll get. So mainly clinically as well as with the help of radiology, we'll be able to diagnose the head injury.
So, I'd like to know more about traumatic brain injuries such as concussion, contusions, and diffuse axonal injury.
Yeah. Before going to that, one small classification I want to tell how we usually classify. Just like any other classification, head injury is also classified as mild, moderate, and severe. When we say mild, it is basically based on the consciousness of the patient. If patient is more or less alert, obeying what we are telling, and giving appropriate responses, it falls into a mild head injury. If patient is really very drowsy, but responding to painful stimulus, he is speaking some words, but we are unable to understand what he's saying. Some words he's muttering. Usually, it will fall into the category of moderate head injury. And severe head injury patient would be completely comatose in deep coma, no amount of pain, no amount of painful stimulus, or no amount of loud verbal stimulus will arise in. This will be a severe head injury. This is one way. And to answer your question specifically, the words you used, can you tell what is concussion, what is a contusion, and what is diffuse axonal injury? These are specific, very specific terminologies to describe the pattern of head injury of the injury which has occurred to the brain. When we say concussion, concussion directly translates into shaking. The brain has been shaken. You can imagine brain like a semi-solid structure sitting inside a rigid skull box. Suppose what happens if you suppose there is a jelly placed within a steel box and you shake it vigorously, that we can describe as concussion. So severe shaking is concussion injury. The brain has shaken. When we say contusion, direct in English translation of contusion is a blunt injury by a blunt force, the contusion. Suppose somebody gets hit by a blunt cricket bat on the hand. We call the hand is, and the hand turns almost bluish black. That is called contusion of the hand. Similarly, a blunt injury, suppose hit by a rod or hit by against a stone at high velocity, the brain will also get a similar blunt external force, which is called a contusion to the brain. And the other, what you asked, is a diffuse axonal injury, is a very specific pattern of injury where, see, we should remember brain is a semi-solid structure, and grossly brain, based on the outermost part of the brain is the gray matter, and little bit inner part, it is medically described as the white matter. This gray matter and white matter, just like if you have to describe it to a, say, let us say it's a pastry where outside there is cream and inside is the core, the spongy cake. There will be difference in density between the cream outside and the spongy cake inside. Brain is also similarly, outside is a gray matter, inside is the white matter. Then sudden external force is applied. What happens? The brain entirely moves. At the same time, these two materials, the gray matter and the white matter, going to their different densities, relative to each other also they move. The gray matter moves, there is a shearing force, there is shearing between the gray matter and the white matter. And when we say gray matter, white matter, they are nothing but the nerves which are passing. So the nerves are torn in between. Gray is the cell body and the white matter is the axons. So the cell body gets cut off in between, and almost there is a widespread perpetual cutoff of axons in between the gray and white matter. Externally, we won't be able to see very severe bleeding, but internally, at multiple points, multiple axons would have been cut, and usually, in such, it would be a very severe traumatic injury, and which will have poor prognosis in many cases.
So my next question for you is, what are the common symptoms and signs of traumatic brain injury?
Yeah, let us start with symptoms and signs. When we say symptoms, most of the time, patient himself, if it is a mild or moderate injury, patient himself will tell you that I had injury to the head and my head is aching. And if it is severe, in severe cases, if the patient is comatose and brought to the emergency, history will be given by the bystander. Apart from head injury, other symptoms include there will be external signs of trauma. Head and face are very closely interconnected. So the patient will have other bleeding from other sides like ear bleeding, nose bleeding, bleeding from the mouth. Vomiting is one more very common symptoms. Brain, when injured or any insult occurs to the brain, responds with vomiting response. So vomiting is commonly seen. And any irritation to the brain is one response which the brain also gives is seizures. So the patient might also have associated seizures. One more thing is loss of consciousness. Acute insult to the brain just shuts down. So loss of consciousness is one. Sometimes loss of consciousness may not be complete. It will be partial. That is, he'll just lose touch with the senses and inappropriate speaking, losing orientation through the time, place, person. These are the common symptoms of head injury. And signs, when we have to say what are the signs of head injury, as I described, the external stigma, the external injuries which are there. Apart from that, there are very specific medical signs, like we examine the pupils. When we say pupil, what I mean is if we see anybody's eyes, there is the eyeball, the black circle which is in the center of the eye. Inside this brown circle, there's one more black dot which is called the pupil. This pupil is a very important vital sign in cases of severe head injury. Usually, in a normal person or in mild head injuries, these pupils, the small black dot which is in the center of the eye, they remain equal in size in normal patient or mild head injuries. In certain specific type of head injuries, if the injury is too much, this on the one side pupil will dilate, will become big, and the other will remain small. So difference in the size of the pupils is one very important indicator of the severity of head injury, and it is like an alarm bell. If a neurosurgeon sees it, it rings an alarm that he has to act very quickly, immediately. If not, if a quick action is not there, then there is impending permanent brain damage and even death. So when I and other signs would be, sometimes we try to assess the severity by seeing the motor response of how the hands and the legs respond when painful stimulus is given. Suppose a very alert person, if you give him a painful stimulus, he will verbally tell you, don't don't give this painful stimulus to me. Suppose he's not that alert, he'll try to push away the painful stimulus without telling. Even if the consciousness even comes down, maybe he'll not be able to push out your hand exactly, but he'll somehow try to reach out to your hand and avoid the pain. Even if consciousness is even down, we call it as flexor response extensor. That is, he'll just try to bend his hands. And even in worst cases, if you give painful, patient will go into an arch-like position. All the hands and the limbs will stretch and extend. So, which we call as extensor response. And these are all very much too much in-depth medical examination points, which I'm trying to tell. This way, by examining, we'll come to know an idea of how severely the brain has been damaged. These are the signs. And there are other signs. We'll take the help of radiology. CT scans are available. One thing about brain is other parts of the body, suppose hands, legs, it is visible, but brain is so much concealed within the skull, it is not visible. So CT scan is like the eyes, our eyes, which will go and give a picture of how much is the damage inside. And based on the images we get in the CT scan and the pattern of the injury, that will also give us an idea of how the severity of the injury and which part of the brain has been damaged.
Thank you, sir, for your answer. So, how do you determine the severity of a traumatic brain injury?
I think I answered this in my last question when I said severity, as I said regarding the pupil size, which I just mentioned, and the motor response uh, of how when we give a painful stimulus, will he tell you not to give him the painful stimulus, or will he just push away your hand, or will he just attempt to push but unable to push, or is it like he'll simply flex, the patient just flexes his limbs, or the patient extends? This will give us an idea about the severity. Also, as I said, the consciousness of the patient, is he fully alert, or he is like semi alert, semi conscious, or is he fully comatose? This will give us an idea about the severity. And in most severe cases, the pupil will be one side, unequal pupil will be there, and the response would be patient will unable, when you give him a painful response, he won't be able to push away your hand. He'll just try to either flex or extend and unable to push away the painful stimulus. And worst cases, there'll be absolutely no response.
Thank you, sir. So, what imaging techniques are used to assess traumatic brain injury, and how do you interpret the results?
The most common imaging and the most widely available is a CT scan of the brain. CT stands for computed tomography. Is the most commonly used for traumatic or head injuries, available in any tertiary care center. This is most commonly used, and based on the pattern, once we take CT scan is just like taking a photograph of the brain. So we'll be able to get images of the clot which is present in the brain. Is there a clot? There is no clot. If there is a clot, what is the volume of the clot? Where is the clot? Is in the front part of the brain, side of the brain, the center of the brain, or is it in the undersurface of the brain? Will give us an idea. And there are certain patterns also which we describe. And when I say patterns, we should understand that brain, there is a skull, and within the skull is the brain. Between the skull bone and the jelly-like brain is covered by a covering called the dura, which is a covering. So based on the location of the bleed. So if I have to simplify, there are three layers, like three walls. There is a skull, first wall, outermost wall. Next wall is the dura, which is the intermediate one, and next is the brain. So blood can be present so if there are three walls, now there are how many compartments? There are three walls, there are almost three compartments now. The first compartment is between the skull and the dura. If the bleeding is present there, medically we call it as the extradural. If the bleeding is present below the dura and outside the brain, we call it as a subdural. If the bleeding is present within the brain itself, it is called an intracerebral. So these patterns we can identify, and treatment will also change. Our surgical approaches change based on the pattern of the injury and based on the location of the blood clot which is present.
Thank you, sir. What are the immediate and long term complications associated with traumatic brain injury?
Immediate, see, once again, the answer to this will vary based on the severity of the injury. Mild head injury, patients will have maybe 3 to 4 days of headache, giddiness, mild symptoms, and in the long term, say in almost 3 weeks, 4 weeks time, they'll be almost back to normal. They'll be able to join work or school and start leading a normal life. In moderate and severe head injuries, in moderate head injury, the course will be slightly prolonged. Patient is patient might take anywhere between 2 to 3 weeks to come regain his consciousness, for him to be alert and give appropriate responses. Sometimes if patient needs any surgical intervention, that will add to the morbidity, and recovery from surgery, it will be a prolonged hospital stay. And in case of severe head injuries, when we say severe head injuries, the prognosis is most of the times not great. There are, however, I can't make a generalized statement, but in many cases, the brain will be permanently damaged, so the patient will have permanent neurological deficit. When we say permanent neurological deficit, what we mean is patient will have either one of the limbs, either the hand or the legs would be permanently disabled. So short-term complication would be loss of quality of life, loss of work, extra financial burden to the patient, to the patient's family, and caretakers who also will have to get involved, patient as in the family members. When we say long-term, mild and moderate head injuries, long-term, most of the times they recover and they'll be able to lead a normal life. Severe head injuries, sometimes patients will succumb to the head injury. Suppose they survive, they'll have permanent disability in the form of one of the limbs or the legs may not be moving. So such patients will become may be bedridden or will permanently need the help of an assistant for daily routine like having food, taking a bath, personal hygiene, attending the washroom. So, which will add an extra financial burden, also emotionally very challenging for the patient and for the family members, and socially also it is very disabling. Many times, severe head injuries, apart from the head injury per se, other complications will set in. It might be an infection which will complicate the entire process, or since he's bedridden for a long time, a bed sore because of lying, sleeping in the same position for a long time. Wound might happen at the lower back region because of prolonged sleeping. Since patient who's always sleeping will start becoming more and more lean, he'll lose body mass, muscle mass, fat, he'll gradually become emaciated. And as I said, yeah, fungal infection, if proper hygiene is not there, superficial skin infections may occur. Even simple things like brushing the teeth might become a big challenge. Oral infections can occur. Patient can't go to the washroom or the urine. So he'll be has to be long term for urine also. There has to be a urine pipe. Long term urine pipe will lead to a complication like with urine infection. So it is a very difficult journey for the patient and more so for the family members. Sometimes patient sensorium might not be that great for him to feel and sense what's happening with him. But the patient attenders, the family members, it's a really traumatic experience for them.
Thank you, sir. What are the treatment options are available for patients with traumatic brain injury?
Yeah, once again, I'll have to categorize this as treatment options for mild, moderate, and severe head injury. Mild head injury medically can be managed. We'll give certain pain medications, and there are certain medications which are given just the way, just like any other part of the body. Once injury occurs, that part might swell. Brain also responds that way. There might be some swelling in the brain. There are medications which are given to reduce the swelling, medications given to prevent a seizure. So medically, patient will what improve. When moderate head injuries and severe head injuries sometimes can be managed medically just with the same pain medications and medications to prevent seizures, medication to reduce the brain swelling. And in certain cases, we'll have to go for surgical approaches. What are those cases where we have to go for surgical approaches? Suppose there is a clot which is compressing the brain and which compressing the brain, then surgically a neurosurgeon will go open up the skull and evacuate that clot and decrease the pressure on the brain. So medically and surgically, moderate and severe head injuries have to be treated. And this is the primary treatment. Once the primary treatment is done, then starts a sub prolonged course of treatment where for moderate and severe head injuries, where post-operative care, treating the patient with certain medications, help of a physiotherapist trying to mobilize him, ensuring good wound healing, daily wound dressing, nursing care. This might take another 15 days or say 2 to 3 weeks. Then starts a prolonged rehabilitation course where we'll have to help the patient to get back to his normal life, get back to his work, and start earning his living, get back to all. Suppose he's an artist or any involved in any skilled work, rehabilitation and assistance so that he gets back to his work. This will be a prolonged course which might take months.
Thank you, sir. How do you approach the surgical management of traumatic brain injury?
Coming to surgical management of traumatic brain injury, the topic per se is a very vast topic and it involves a lot of intricacies. So I won't be doing justice by describing it in a few minutes. However, to simplify it, when we say surgical approaches, we can broadly understand it as there is a clot within the brain which is compressing the brain, causing disturbance, which has to be opened and that clot has to be brought out. So this is that target. So, or there is too much swelling in the brain, which is causing severe compression of the brain. So this compression has to be relieved. This is the target of the surgery. So how do we approach this? First of all, a CT scan will be done to ascertain, is there a clot? Is there swelling in the brain? If there is a clot and if there is too much swelling in the brain, then surgically it will be planned, and depending on the location of the clot, as I said, the skull and the dura will be opened and the clot will be removed. There's one emergency procedure which is done, which is called as a decompressive craniectomy, which is an emergency life-saving procedure which is done in case of severe head injuries, where the brain start, because of the head injury, the brain starts swelling. When the swelling becomes too much, the brain does not have much space to expand. So a part of the skull, that is a part of one side of the skull, is removed and given space for the brain to expand. So this is done as a life-saving measure. So to just sum it up, either we remove one half of the skull and to give it space, or sometimes remove the skull, remove the clot, and if swelling of the brain is not too much, we place the skull back. These are the, in short, the surgical approaches to head injury.
Thank you, sir, for your answer. What measures can be taken to prevent traumatic brain injury in high-risk populations?
Yeah, one good thing which is happening nowadays over the last 10 years is traumatic brain injuries, are the incidence and the prevalence of traumatic brain injuries is decreasing day by day, owing to increasing road safety measures with the help of the government, and with increasing public awareness. People are wearing helmets. More people are able to afford cars. So the chances, so road safety standards have increased. This is one good thing. And so, however, we are still continuing to have head injuries on road. Wearing two-wheeler people who using two-wheelers have to wear a helmet even if it is for a short distance. There absolutely can't be any reason for not to use a helmet. And if financially somebody can afford, I would always say use a car, which gives you an extra safety. In a car, if even financially, if it is possible, always look into the safety measures of the car, where the airbags are available. All these things go a long way in increasing safety. And as I said, the other places are in construction work places. So safety of laborers, most of the times it is the uh, people working in the lower strata in the hierarchy. It is the manual laborers who are affected. Compulsory use of helmet should be there. And the sling ropes, many times we see construction workers, painters, electricians working at high-rise buildings without safety gear, without a sling. Suppose a small slip and fall can be life-threatening. So, however, I'm happy that in big engineering companies are providing these safety measures. Sometimes in certain other areas, these might get neglected without proper safety measures. So this should be brought down at a policy level. Compulse, however big, small, is the construction area or the employer company which is offering the engineering services, have to ensure patient what the safety of the laborers using safety equipment. This is what mainly this one, road safety and workplace safety. This way we can, and awareness. So and awareness is always, it is good if a common man comes across a person with head injury and he's comatose, that means you can have a good amount of suspicion that brain has been damaged. So rather than rushing him to a nearby small nursing home, I would always suggest rush him to a nearest big tertiary care center, where the chances of having a neurosurgeon increases. Because when it comes to brain, there's a saying which says time is brain. Time lost is brain cells lost. So most of the times people lose time in first rushing to a nearby clinic. From the clinic, the patient goes to another small nursing home. From the nursing home, there won't be a neurosurgeon available. He is rushed to one more center. There they come to know that neurosurgeon is not available. Then they go to a big center. In the entire process, 4 to 5 hours of precious time is lost. So rather, in case of a head injury, always go to a nearest tertiary center. It might be either government or it might be private, at least the chances of having a neurosurgeon in a tertiary center is much higher than a smaller center. So what as a common man is, if they suspect a head injury, don't take to smaller setups. Always go to big setup where a CT scan is there and a neurosurgeon is there.
Thank you, sir. Can you describe the multidisciplinary approach to rehabilitation after TBI?
See, as I said, rehabilitation mainly involves a lot of work is involved by the physiotherapist. Depending on the neurodeficit involved, they'll start giving him physiotherapy if the limbs are not working, everyday physiotherapy, and sometimes the patients might also have problems with the urinary problems where urinary catheterization will be needed. If patient has most of the times in severe injuries, it is not just the brain which is affected. Patient might have other associated a fracture where an orthopedician gets involved. Patient have fractures of the bones of the face where an dental surgeon gets involved. Patients might have deglowing injuries where the entire skin is peeled off. In such cases, a plastic surgeon gets involved. And when it comes to rehabilitation, yeah, physiotherapists will be the team leads in the rehabilitation program.
Thank you, sir. What are the key components of a comprehensive rehabilitation program for TBI patients?
See, if I have to say key component, first of all, for severe head injury, in rehabilitation, it is a patient's testing for both the doctor as well as the patient and the patient attendants. Because the treatment course will be a very prolonged, we are not talking in terms of days, we are talking in terms of months. So it will be financially draining, it will be emotionally draining. It is a game of patience where you will have to be patient, persistent, disciplined. There will be many instances where patient attendants and the doctor feels like losing hope. But there are a number of examples where severe head injury patients, after a prolonged good rehabilitation program and good treatment, they've gotten back to work, started leading a normal life. So key component is a good physiotherapist, have patience, don't lose hope. Yeah, and take medical guidance rather than sometimes right now wrong information is very easily available over the internet or WhatsApp. So going for the right medical advice is of utmost importance. Otherwise, we'll be losing time as well as money in following wrong advice and following wrong treatment. So being in the right place at the right hands and being patient and persisting is the key component.
Thank you, Dr. Jaydev, for your insightful responses and expertise. As we conclude, we extend our appreciation to all participants for your active engagement and valuable contributions in reaching our discussion. A special thanks to our esteemed speaker for their invaluable insights contributing to the success of this webinar. Stay connected with us for future events and collaborations. Thank you for being the part of 2050 Healthcare community with you in every step.